everyone for joining us this morning. It has been over 3 years since the COVID-19 pandemic began and was declared a public health emergency. Some of the enhanced benefits and changes to rules for critical housing assistance, nutrition assistance, and health insurance are tied to the public health emergency. With the public health emergency coming to an end on May 11th, we have some questions and concerns about how these programs are going to return to the pre-pandemic status quo. Luckily, we are joined by two experts today to help us in understanding what is and what's not going to change in May. Our first guest is Dr. Joe Savage Jr. He is a recognized leader with over 20 years of experience in the fields of homelessness, social policy, economic development, and human services administration. His prior work experience encompasses positions in which he was responsible for overseeing transitional and permanent supportive housing programs, continuum of care funding, strategic planning, and coalition building. His passion for this work has cultivated years of skills and expertise that have helped bring millions in funding to support housing and services for those experiencing homelessness. Joe's commitment to this work is rooted in his belief in the dignity of human life. We are also joined by Heather Jo Sally, who is a staff development specialist with more than 8 years of experience working with the Office of Income Maintenance at the Commonwealth of Pennsylvania. Heather is responsible for planning, executing, and evaluating instruction as part of a standard training program required for all newly hired caseworkers at assistance offices across the state of Pennsylvania, and is also involved in the professional development of those caseworkers. She is highly versed in public assistance programs, including but not limited to SNAP, medical assistance, and TANF. Heather is a powerful force both inside and outside of the classroom, where she uses her passion for helping those in need, enthusiasm for public assistance supports, and general positivity for promoting promising futures for Pennsylvania residents. So I can't think of two better people to help us figure out what's in the coming month. So I'm going to hand it over to Joe first to just give us an overview of, what even is the public health emergency, and then talk about what's happening on the housing and homelessness assistance front.
Thank you so much, Gail, for that introduction. And thank you, Jen, Gail, and the Alliance for having me back with you all. It's always a pleasure. Let me just get my screen up here real quick. Here we go. This is the one that I want. And before we jump into this, I just want to, thank you all for the work that you have done on the front lines and really helping to mitigate the spread of the pandemic amongst those experiencing homelessness. I think one thing that this pandemic has taught us is that we can do things better and we can do things more efficiently. And not only has it taught us that we can do things better and more efficiently, it's also taught us that when it comes down to allowing waivers and flexibilities for programs and requirements, it's really not that hard to do. Prior to any type of, public health emergency or any type of crisis, it's always, well, we're not sure if we can do that. We're not sure how long that will take to implement, etc. But what we've really come to learn is that some of these flexibilities and waivers can be, decisions can be made quickly and can really help folks operate more efficiently. So what I want to do with my portion of today's webinar, I want to talk about the various sources of these waivers and flexibilities so that people really have an understanding that you have the public health emergency, but you also have other things that were put into place that allowed for flexibilities and waivers, and they don't all come from the same place or the same source, and their expiration will vary based on out of where that waiver came. So let's look at that quickly. So essentially you have 5 major sources of the waivers and flexibilities that we've had since the pandemic. There's been the CARES Act that was passed in March of 2020, and it provided a number of waivers and flexibilities related to COVID-19 as it related to specifically HUD funding, whether it's ESG, CARES funding, etc. And then you have the public health emergency that was declared in January 2020 that is set to expire this upcoming May 11th. And then, of course, there was the Consolidated Appropriations Act of 2021 that was passed in December of 2020 that also provided some relief, but that was connected to the FY22 federal fiscal year. And then, of course, you have the American Rescue Plan Act that not only provided a number of dollars, but also some reliefs and flexibilities, and that was passed in March of 2021. And then finally, you have the Stafford Act. And for most of you, you're probably familiar with what the work that you're doing and the reimbursements that you're getting from FEMA and the flexibilities and the waivers that you were allowed under FEMA. All of that is coming out of the Stafford Act. So you have these 5 different components, and they all allowed for waivers and flexibilities of various natures during the pandemic. And so the focus of today's topic, and what my colleague Heather will get into, how is all of this affected by the end of the public health emergency? Because there are waivers and flexibilities that are the result of the public health emergency. Then there are those flexibilities that come out of one of the other 4 components. However, their expiration can also be tied to the end of the public health emergency. So what I want to show you guys next is, you may have seen this similar document, expiring federal provisions that may impact homelessness. We released this initially in May of 2022, and some of you may have seen that version, and we put together a very nice chart. It showed what the source of the waiver was, what its current status is, and how it's going to be impacted by any potential, at that time, potential expiration of the public health emergency. So we are now in the process of updating this document, and we'll be releasing it shortly. But what I wanted to do, I just wanted to give you all a quick look at some of what's in there. So you should now be able to see a Word document that I have up on the screen. This is what I'm referring to. This will be posted to our website.
We're actually not able to see the document. We're still looking at the PowerPoint.
Okay, hold on for a second. So let me see something. I know what I need to do. All right, Gail, now can you see the PowerPoint? I mean, the Word document.
We can see the Word document.
Okay,
yes.
great. All right. So this is what the document is going to look like when it's released. Make sure you go to our website, www.usich.gov, and sign up for a newsletter if you haven't already done so, and also link up with us via Facebook. That way, when this document is released, you will get the notification. So this document is going to be updated to reflect what's going to happen as a result of the public health emergency expiration on May 11th. And just some of the things that I wanted to highlight. What we had to do is we had to reach out to our federal partners and have them give us what they are considering doing once the public health emergency expires. So for instance, with this first one, if you're talking about the Emergency Solutions Grant Program under the CARES Act, what's going to happen once the public health emergency expires? Communities will still be allowed to enact the waivers and the flexibilities for up to 12 months after the declaration expires. So they'll still be able to provide shelter for individuals and families displaced from their normal place of residence under the flexibilities that were allowed as a part of the CARES Act. So these flexibilities came through the CARES Act. They're tied to the expiration of the public health emergency, because those flexibilities under the ESG CARES Act will end 12 months after the declaration expires. Then, to give you another example of those waivers and flexibilities under FEMA, I have it here highlighted in red, May 11th, 2023. That marks the end of the public health emergency. and the emergency work completion deadline and the applicable end date for all COVID-19 policies and declarations. The costs incurred for work related to COVID-19, including non-congregate sheltering after that date, will not be eligible for public assistance funding. So that FEMA funding that has been allowed will no longer be billable after May 11th. However, the caveat to that is there may be costs associated with demobilization, disposition, and disposal activities. So as you see highlighted in red in that last sentence, FEMA is providing a limited 90-day extension to complete demobilization, disposition, and disposal activities. Just to give you another example, some of the flexibilities under the Supplemental Nutrition Assistance Program, the partial suspension that has been allowed, that will apply through the end of the month subsequent to the month in which the public health emergency is lifted. So as you can see, what this document is going to do, it's going to give you the program. It's going to talk about what the flexibility is and how the public health emergency expiration date affects the expiration of that particular waiver or flexibility. And then in the final column, you'll be able to access the actual resource that gives you more information on what the flexibility entail. So you can be able to really use this document to help guide the services that you provide, to help you understand what changes are going to happen based on the particular type of flexibility. Now, the last thing that I will say is this, and something I want to highlight that we put here at the end of this document. This sentence right here: the status and timelines of these provisions continue to evolve. And the reason why we put that in this document is because one of the things we've been doing at the federal level, we've heard from you all in terms of the benefit that a lot of these flexibilities and waivers have done for you in terms of being able to provide services, being able to do it more efficiently. And so even though there's some expirations that are coming, we are considering what can we put in place to remain permanent, and how can we make those changes at the federal level so that they last beyond the public health emergency and any type of pandemic. And so we put that in here because based on those discussions, some of these expirations that are currently in this document can change. Once we even release this document, we will also update it accordingly. But the key thing that I want you all to understand is that we did hear you in terms of, you know what, this really works. This type of waiver, this type of flexibility, it really allows us to operate more efficiently. It took away a lot of the red tape, etc. We did hear you and we did listen, and our federal partners are thinking about ways in which particular waivers and flexibilities can be made permanent. So again, go to our website, sign up for a newsletter. When we release this document, you will get notified, and it will have all of the information in it pertaining to various waivers and flexibilities and relief efforts and what their relation is to the expiration of the public health emergency on May 11th. So that's it for me. And I give it back to Gail, or does it go straight to Heather?
I'll take it back. Thank
All
you
right.
so much, Joe. Somebody had asked what the website is again. So if you could just...
It's www, and I'll answer it in the Q&A, www.usich.gov. And when you automatically go to the website, it's going to ask you to sign up for the newsletter.
Excellent. And I did actually already put it in the Q&A, but I just wanted to make sure for folks who may not have seen that. So thank you so much for that overview. And of course, we at the Housing Alliance will be keeping an eye, and will be resharing through our own Facebook and social media once this document is updated and released. So next, we're going to bring it a little bit more local for all of those programs that do get administered through the state. And with that, we have Heather to talk about how the state is handling these upcoming changes.
Hi, Gail. Thank you so much for the wonderful introduction. And Joe, very insightful information on the federal level. I'm looking forward to getting that information and sharing it with my colleagues. Give me 1 second so I can share my screen, make sure you guys are seeing what I am going to present. Okay. Does that look good?
Yep.
Okay, perfect. I'm typically using Teams, so come and go with Zoom meetings for me. As Joe mentioned, we have our public health emergency that is set to end. It's coming up quicker than we can even anticipate. And just as he said, things are changing daily on a day-to-day basis on the federal level, but also on the state level as well on what we are doing. So at DHS, we have actually been making as many preparations as possible to help those in our community in Pennsylvania that this could perhaps impact, which will be a lot of individuals and families. Now, as the populations we work with struggle to meet their basic needs for survival, home security is and obviously will continue to be an issue. When you couple that with housing insecurity, when you couple with housing insecurity, many of these same individuals may also be facing the matter of food security and health security, all of these which are basic needs for survival. We at DHS are striving to do everything we can to make the continuation of our benefits that offer food and health security in the form of medical assistance as accessible as possible to keep these benefits in place. Now, today I've brought information to provide you that you can use to help your clients and your individuals with whom you're working to provide you an insight as to what we are doing and hopefully help soften the transition from the extra supports that were in place, but during the public health emergency and what is upcoming in the upcoming months. So we on the state level refer to the ending of the public health emergency as the unwinding of the public health emergency. And when we think about this, there are some key questions that come to mind. What does this mean? How is this going to impact Pennsylvanians who are already receiving these benefits? DHS has been implementing planning to prepare for the ending of both extended medical assistance programs and SNAP. Those are the two things I'm going to present to you today. So we'll talk about both of those in separate entities here in the upcoming slides. Now, the big question is, how is this going to impact current recipients? There may be potential reductions in money for groceries and potential loss of medical coverage. However, I have to impress, we want the public to know that that there are so many things out there that DHS is doing and that customers can also do, and that we as community service agencies can do to ensure this does not impact as many people as possible. So the very first thing I want to talk about is our SNAP program. And as a response, okay, so during the pandemic, SNAP recipients were receiving a second SNAP benefit allotment. Typically, before the pandemic, SNAP recipients received one monthly payment for their food stamp benefits. During the public health emergency, we were providing a second monthly payment that was issued at the end of the month for everybody that was receiving SNAP, no matter how much benefit they were receiving. Beginning March 1st, Pennsylvanians receiving SNAP benefits stopped receiving those supplemental payments. So what this did is it actually resulted in households losing a minimum of $95 per month, and it comes out to a statewide average about $181 per month per household. So that is a big reduction in food support. Now, as a response, there has actually been recent policy that has been passed down to the state that allows for the temporary suspension of all of our SNAP interviews. The process of receiving SNAP that did and does require a telephone interview at minimum in order to authorize the benefits. However, there is currently, I think it just happened in the past 2 weeks. We issued a waiver that is right now going to last at least for the next year. And this allows for us to waive all interviews for new SNAP applicants and existing SNAP applicants. So the key takeaway from this is as long as all information that is available and needed to process and continue SNAP benefits. And that would be income information, essentially, identification information. If we have all of that in a SNAP application and or the renewal, that would be the renewing of the benefits, can and will be processed with no interviews. So the impact on our customers means that benefits can potentially be issued quicker. In addition, I know for Forefront, Pennsylvania has been working diligently to onboard new caseworkers in every single county across Pennsylvania to ensure we have the staffing to keep up with this demand. So right now, my team also is currently training almost 80 new caseworkers for the field. So very good, very good responses that we're doing. We're doing everything we can as far as the SNAP program. Things are changing daily. We have not gotten any word about the ABODs, the work requirements coming back in. So that's something that, we're still kind of looking to see if that changes or it still remains waived. Now, probably the biggest question is, what can we do as a social service agency to help these individuals? There is actually a really good resource out there, and I want to be able to. Is there a way to post a link in the chat for the website, or I could just show
Yeah,
it?
you should have chat available to you to put it in there, and the attendees should be able to see it.
Okay, yeah, chat. All right, I could just put it in chat. Perfect. I want to throw this link up and then I'll show it to everyone. It's really cool resource that's out there on the pa.gov website. And I'll post this and then I will actually show this up here on my screen. It's the SNAP Cares Act. And let me take you there. This is actually a DHS website and available to everybody across the community. And it just gives a little more information about the ending of the SNAP extra payments. What I really like about this site, though, is it gives you a what can I do now? Okay, so how can I increase or how can I make sure I'm getting the most benefits I possibly can to feed my family? It gives some information on that as to what you can do as far as the SNAP benefits go, but it also gives resources on finding additional help. So we not only have the 211, the pa211.org, but also the Feeding Pennsylvania link on there, and also the Department of Agriculture website and the DHS Ending Hunger program. So those are definitely additional resources that you will absolutely find helpful when working with the public who may be facing food insecurity. With that, I kind of want to move into the medical component of and how that is being impacted by the ending of the public health emergency. It is required that MA recipients renew their benefits yearly. That's per policy. However, this benefit renewal has been on pause since 2020. Now, because of this, many of our recipients who are receiving medical assistance may not know or remember when or how to complete a renewal. DHS has implemented a variety of responses to help streamline this process and make as many people in the community who are recipients know that this is going to be happening. And we've been doing it in many different ways. We've been doing direct mailers. We've been sending out texts to those individuals who have opted in to receive text notifications. We've been sending out emails, and we've been doing public outreach with community service partners. Okay. The most important thing that the public needs to know is that even though beginning April 1st, Pennsylvanians who are receiving Medicaid or CHIP will have to complete those annual renewals, it does not mean that they're going to lose their medical coverage. Okay, they will be given the opportunity to renew their coverage. And the supports that we have in place, we're doing everything we possibly can to help streamline that process. This is just a little bit of background information for people who are already receiving Medicaid. They will be receiving, and it won't be all at one time, but it's dependent on when they began receiving medical assistance. They will be receiving their renewal packets. They're called the PA 600R to renew their benefits. And what happens is we need just an updated completion of that form, and typically we will need income verification and sometimes resource verification, depending on the category of medical assistance they're receiving. It does have to be completed timely. So when these go out, it is extremely important for our customers to know, or anyone that's receiving medical assistance, to make sure the DHS has their appropriate contact information. Addresses are updated, because when a renewal comes, when that packet comes out and they need to renew their benefits, it has to be completed within 30 days in order to continue that coverage without any interruption in services. Okay, so they're no longer going to be staying open automatically, but we can do as much as we can to help prevent this. There may be some medical assistance recipients who will no longer qualify for medical assistance because they're over income, because the renewal is completed, income has increased. So most likely we will have many Pennsylvanians who are no longer eligible for medical assistance. But CAOs, this is another brand new thing that kind of just came out last week. CAOs are now processing the CHIP applications on top of medical assistance applications, and those children who may be losing coverage due to an increase in their family income will automatically be reviewed for CHIP if they are over income. So that's a great service that we have in place. Bringing in all these extra caseworkers will actually really help that process as well. If the children are eligible, they will be contacted via mail with what they must do. Some will qualify for free CHIP. Now there are different levels of CHIP coverage, and there is a free CHIP program. It's all based on income. So the children who do qualify for free CHIP, their coverage will begin automatically. However, there are different CHIP programs that are dependent on the household income. So some children may be eligible for CHIP but may have a copay. So what will happen is when they are determined eligible, they will get a notice in the mail that they're eligible and the copay that's required. And once that copay is paid, then their CHIP coverage will start. So it must be actually made, the copay must be made prior to the CHIP coverage starting. We may have some adults or individuals who are not meeting the CHIP requirements. They will also be referred to Penny, which is now the state-based exchange or marketplace for health insurance that Pennsylvania has out there. So you can see on my slide here, it's just penny.com. That definitely is a very good resource to have out there. And just as a visual for you, the homepage for Penny does look like this. And that also is another link that can be shared in the chat. There we go. Okay, and just a couple more slides here. As again, I keep talking about the importance of completing renewals. Now, beginning April 1st, the renewals are going to be sent for medical assistance, which they hadn't been since 2020. It's very important to know this. And it is also very important to make people who are receiving medical assistance aware that they need to have that up-to-date information to complete these when they come. If they have since moved multiple times since they originally got their medical assistance, we can't guarantee that medical assistance renewal is going to get to them. So it's so important to make sure the public knows that they have to make sure that their information is up to date with DHS. not everyone is going to get a renewal all at once. So it's not like April 1st is going to hit and every single MA recipient will get a renewal. That's not how we have it set up to work. We have it set up to work on a month-by-month basis. So each month there'll be a different section of MA recipients who do have to renew their benefits, which is essentially based on when they originally applied for medical assistance or the open date of their original open date of medical assistance. But what can we do in a community service capacity to help these individuals? The biggest thing is just to be educated on what is out there. There are definitely a number of resources on medical assistance and CHIP renewals. We have a medical assistance and CHIP renewals FAQ page. And again, I already gave you that link to Penny, but I'm just going to point out again some medical assistance information that is on the DHS page. This all can be found on the PADHS website. But again, this is the Medicaid and CHIP renewals page. And this actually this does give information on how to even complete your renewal date. Check it out, submit it online, and there's a number of other great tools on here for individuals. And there's communications toolkits and things like that. We also have the Medicaid and CHIP renewals FAQs. So this is really, really, really good to help individuals for whom we serve. I'm just going to give you a couple more links here just so you have them. And these will also be in the PowerPoint when it is distributed, but I want to make sure that you have them now. So I'm just going to keep posting them in there, not paste. Let's go back. There's the renewals one. Okay. Again, Pennsylvanians who are not eligible for Medicaid will be referred to other sources for affordable coverage. And again, that is like our CHIP program, and we will be processing those in our county assistance offices and also the Penny or the state-based exchange, because our goal is to make sure that no one has a lapse in either the quality or the affordability of their health care if they're no longer eligible. The last two slides are just kind of tips and resources. And I already gave you the website to which we can find this, but there are also additional tips and resources that we can give to those whom we are working with. Absolutely, the dhs.pa.gov/compass, that is the online portal to apply for any benefits that the Department of Human Service offers. So if someone does have an access to a computer, that would probably be the quickest and most efficient way to get those applications and renewals completed. Again, a lot of customers do not know when their renewals are set to come, or maybe they don't know if their information is up to date. We have a statewide customer service center, and the number can be found right here. So it would be a good idea to call there. All they would need would be their social security number, and they can find out when their renewal will be due, and also make sure that their contact information is up to date. There actually is a MyCompassPA mobile app, and that's a really helpful tool that many more people are using. In Philadelphia, there's a specific line, and there is a number 1-800-986-KIDS if we have current CHIP recipients, so they can also contact there as well. These are just some resources for you all. One thing I really want to point out, and I'm going to take you there, is we have a DHS helper tool. And I think this would probably be the most benefit for any of our community service partners, because this is, hold on one second, let me put it in the chat. This page is eliciting anybody in the community, be it you're working with a community agency, individuals. It's encouraging anybody in Pennsylvania to become a helper. And what that essentially means is you're signing up to get all the information that would go to our recipients, so you can help forward that information to the individuals with whom you're working. It can be shared on social media. All it requires is just a quick sign up on here with your individual, with your information, email address, organization, what type of helper you would want to be. And there are so many different things that you will get directly mailed to you, suggested messaging for you to put out there, key dates. We have social media graphics available, self-printed materials you can print out and give to those who you're working with, or those who are working for you. There are toolkits and many important updates. So I just really wanted to point this out, that this is out there. Again, we're doing everything we can possible to try to link up not only with our caseworkers and in our agency, but to interact with every community partner out there to get as much information out to the public as we can. So with that, that is all I have. I am going to hand it back to you, Gail.
Excuse me. Thank you so much for that really, really well-rounded presentation. And, I was writing questions down as you were presenting, and then you were answering my questions as you were presenting. So it was really, really great. While we wait for those who are attending the webinar to come up with their own questions, I do actually have a couple of questions of my own. So my first question I'm going to direct towards Joe. You made a great point to say that things are evolving, that they're changing, that you are really looking at how can we make some of the flexibilities and the waivers more permanent. We're the Housing Alliance, we're advocates. I know, U.S. Interagency Council on Homelessness is a great resource, but you guys aren't actually the advocates. We're the advocates. So as advocates, is there a way for us to continue to engage with you all or with the administering federal agency, really highlighting, what are the waivers that we need most?
Sure. And that's a great question, Gail. A lot of what we learned from you all in terms of what you would appreciate as becoming permanent, we got through our listening sessions when we were developing all in the new federal strategic plan. We actually plan to continue to do some listening sessions with communities, with providers, with national stakeholders to get additional input. Now, let's say HUD comes to a point where they're ready to make a decision about a specific waiver and what that would look like for communities. We'll then do an additional outreach to communities to make sure that we are getting you all's input. And I'll always definitely make sure that I reach out to the Housing Alliance, because you guys cover such a breadth of providers and stakeholders. I'll always make sure that you guys get included in that.
Great. Thank you. Thank you so much. And then for Heather, let's see, my question for you is, again, sort of the suspension of SNAP interviews for 1 year. Is this something that you guys could potentially look at, waiving permanently, or is it just the simple extension as part of the unwinding overall from the public health emergency?
Right now, it's set in as, we just got it as an ops memorandum, that it is, and it's always worded in the way that it is intended to end that day. But what we usually see happen is extensions in the background, and there's no way I can really foresee it, but I can say that when we do have programs like that do get extended, the waivers, many times in the past, they have become permanent things. So I can't, speculate as to if it will become something that's permanent. That would have to come down from the U.S. Department of Agriculture and then through us as well. So definitely something, you know, that I'm sure is in the works to look moving forward. The expedited SNAP interviews in the past were never done, and they were something that were recently brought back. And again, now all the interviews are being just waived. So the potential for it to come as something that lasts much longer is definitely out there. Great question.
Excellent, excellent. And then you made a great point to talk about all the ways in which you are continuing to staff up to make sure that you have that capacity to make sure that you're meeting the need. With that, do you still have job openings?
We absolutely do, and we are hiring constantly. So put it out there. DHS.pa.gov, like we have so many different opportunities and openings all across Pennsylvania, particularly in those larger areas like the Philadelphia, the Allegheny area, those bigger areas where we have a higher population of people with needs. The demand for caseworkers is very high. And Governor Shapiro just actually recently waived some of the requirements for bachelor's degrees for caseworkers if they have experience that relates to it. So if you know anyone out there that is looking for a job and would be, you know, a potential candidate, send them our way. We're always looking for new recruits. We definitely need them right now.
Excellent, excellent. And we do have one question from the audience. Does the same apply to MAWD as it does to medical assistance and CHIP? I'm not familiar with the MAWD acronym, so
Oh,
Heather.
that's great. Yeah, I got that. That is our MOD program. It's our medical assistance for workers with disabilities. That is really cool that was asked, because we have also actually added an additional program to MOD. So the medical assistance for workers with disabilities, our biggest concern is the premiums, and they were also not having renewals during this whole time period. So their premiums were remaining the same. Even if their income exceeded the limits, they were still remaining on MOD. And at this point, some of them may not qualify anymore. Well, DHS has come up with a brand new program, which is I actually just taught it to a new class of trainees on Friday. It's called Workers with Job Success Program. So what it allows for individuals who are no longer under 250% of the federal poverty income guidelines to still be eligible for MOD, but they just pay a higher premium. So depending on what their income is, it can be 7.5% of whatever their net income is. So it's just a little bit more than what the MOD premium would be, which is, the regular MOD is 5%. And then if their income does exceed a little higher than that, the income limits are very high. I don't have them right at hand. They can also still be open in MOD, but they would just be responsible for paying the full monthly premium. I think right now, though, it is around $983 a month for the MOD premium if they have a really high income. Yes, but great question on the MOD program.
Excellent, excellent. We do have a question that is fairly local specific, and I think it addresses more homelessness. So I'm going to direct it at you, Joe, but there was a spokesperson from the city of Pittsburgh that noted a number of properties and buildings that are owned by the city and vacant, and talking about developing these properties to create housing for those experiencing homelessness. Are there federal resources out there to support these initiatives, or what would be an ideal resource for people to look like if they're trying to do something similar in their community?
Yeah. So something like that, especially if it's city-owned property, there can be federal resources used to convert those properties into housing, but it would have to go through, let's say, the local COC would have to work with the city to get the city to either donate those properties or sell those properties for an extremely cheap price to, let's say, a local nonprofit. That local nonprofit could then use federal dollars, whether it's continuum of care dollars or community development block grant dollars, to do any type of rehabilitation to transition that housing. So that's the way that would play out at the local level. So you would have to work with the continuum of care to see if they're talking to the city about getting those properties. Now, at the federal level, we do have specific programs for federally owned properties. So if there are any federally owned properties in the city of Pittsburgh, there is funding and there are programs to have those properties converted to housing for the homeless. But again, that would go through the local continuum of care. They would have to incorporate that in their strategic planning as a specific action step that they want to do.
Excellent, excellent. Thank you so much for that clarification. It looks like we have gone through all of our questions. So again, I just want to thank both of our guests. We will be sending the slides out afterwards. Of course, any important links, the Housing Alliance will be sharing information through our newsletters and social media as changes happen, and just to help remind community partners of upcoming deadlines. I'm really grateful for media toolkits that have been put out. So with that, I just want to remind folks about some of the Housing Alliance upcoming events, including our Rural Housing Summit in May, as well as the return of our Home Matters Day, Lobby Day in Harrisburg in June. So we hope to see you all there. And with that, I wish everybody a good afternoon, and go grab yourself some lunch. Thank you.
Thank you, everyone. Have a great day.
Thanks, everyone. Have a good one.